All right. Hello, everyone. Thank you for tuning in. Thank you for watching today. I'm Dr. Niki Davis. We are here with the Lifestyle Telemedicine group, including Dr. Jeff Pierce. Thank you, Dr. Pierce, for being with me today as well.
Hi.
All right.
Here.
And I love it. You're always in your beautiful teal colored room.
That's right. Teal is the official color for telemedicine. I don't know.
Yeah, that makes sense. That makes sense. It's like very calming. And we have a great guest today. So Debra PerryMills is with us, and she is one of our lifestyle telemedicine patients who has a pretty incredible story. So we really wanted to share this with people. And I know that Debra had mentioned to me that she really was hoping that, boy, if we could even just help one person with my story, then it's worth coming on here and talking about it. And I do think that it is a really important topic because low thyroid or hypothyroidism is quite common in the United States, and so that's the topic of the day. We're going to be talking about this interesting story of low thyroid or hypothyroidism, and something that Debra had to work pretty hard at trying to figure out what was going on and advocate for herself. So we're going to talk through that story. So thank you, Debra, for being with us today.
You're welcome.
All right. So I guess, first of all, I would love to hear where people are watching from. For those of you who are watching us on YouTube or Instagram or Facebook, I know we're on LinkedIn as well. Debra, where are you located?
I'm in Santa Rosa.
Oh, that's right. Oh, so jealous. So have you actually gotten to meet Dr. Pierce in person?
Oh, yes.
Great.
Yeah,
and how's the weather there today?
Oh, mixed. Wouldn't you say,
Yeah,
Debra?
it's
We had
mixed,
some
it's
sunshine.
mixed.
Little sunshine, little rain. It hailed yesterday,
Oh.
which was exciting. Deb and I get together with some good friends for potlucks and restaurant meetups. We're working on making that a more regular thing, and so I've seen Deb's cool little farm that she's got, and yeah, it's neat getting to meet your patients and get to know them a little bit better. And then you're like, are they friends? Are they patients? And it's great like that.
Yeah, I agree. All right. Well, we've got Rachel watching from San Francisco. I think I know Rachel. Thank you for watching, Rachel. All right.
Hey, Rachel.
And then we have Laura watching from Alabama. Thank you for watching, Laura.
Cool.
Oh, we've got somebody here in my own home state, Utah.
And your own county. Did they name the county
I'm not
after
in
you?
Davis County. I'm not in Davis County. I know. No, they didn't. Okay. We've got somebody watching from Georgia. Welcome. Thank you for watching. Fantastic. We've got people watching from all over the place. So thank you, everybody who's joining us today. I wanted to start out by just asking you, Debra, what your story is as far as, now I understand that you do eat a whole food plant-based diet.
Yeah.
I'm curious about kind of how you got started in that. What precipitated that? Kind of how did that all begin? When did it start?
So very interestingly enough is that I come from a very meat-eating background. And even here on the farm, we still raise meat goats, but we raise meat rabbits. So definitely, I've never been like a fast food junkie person, but definitely the standard American diet with lots of meat and butter and milk and cheese. And that I was a vegetarian for like a very short period in my earlier life. And then one day my best friend called me up and she's like, we're going plant-based. I said, she was having some health issues and she had done a dive, went on a few different sites, and she's like, I'm doing this. And I go, okay, let's do it. I mean, it was literally just that. I literally went from a full standard American diet to plant-based in like a millisecond. It took me probably an extra 2, 3, 4 months to completely get SOS-free.
And
Because
tell
I was
people what that is if they don't know.
that's no people when I tell people that, they're like, "Are you serious?" So that's no salt, no sugar, and no oil. So virtually didn't eat out, didn't eat anything out of a box, nothing out of a can, absolutely nothing. And it was a little rough at at first, but I'm just the type of person that I just jump straight in. So we started out, and it took me a few extra months to really get SOS free, because at the time I was probably sucking down a large bottle of Toriani every 3 or 4 days in my coffee with the tons of cream. And it was a habit that was really the last one for me to break. But once I did it, I was super, super, super strict. I'm going into year 4 of being plant-based. So very, very diligently strict the first 2 years. I mean, nothing passed through my lips that was processed. I didn't eat out. Nothing like that. So made everything from scratch, from my crackers to every bit of food. And my husband was doing it with me. He since has gone back to eating, non-plant-based, but still gets what I cook. So
Nice.
Okay. And when you initially went plant-based, did you notice any changes in your health or how you
oh
felt?
yeah. I mean, it really was almost immediate. We had started, my best friend Nick and I had started doing more exercising. I've always been relatively fit, but we started walking, and so notice in blood pressure, I was on a few different meds at the time when I started. Subsequently, I'm really not on any of them any longer. So that took a little while. I titrated off of my medication slowly, after about a year or so, I think. But yeah, it was a pretty energy, I did lose weight right away. I'm a pretty small build anyway. So, I kind of upped my protein a little bit more and tried to, counterbalance that. But other than that, yeah, it was energy, skin, hair, nails. I mean, just everything.
Yeah. And then, so the medications you were able to get off were mostly blood pressure.
Blood pressure meds. I was on a medication that was for interstitial cystitis.
Mm,
So that was a big one for me to get off of. I also
yeah.
was on gabapentin for post-neuralgic nerve pain. And I really wanted off that one. That was probably the one that was like, I can't be on this medication forever, just because of all the potential long-term side effects of being on it. So that was really super, super, I was so grateful that I was able to just decrease that and get off of it.
Well, great. So it sounds like, switching your diet over to this kind of whole food plant-based diet, SOS free, gave you the ability to really improve your health quite dramatically and getting off those medications. So tell us a little bit about, at what point does this hypothyroidism story begin?
Hypothyroidism. So I had seen, the encapsulated version is, I had gone to see a menopause specialist, as I'm knee deep in that. And that just creates a whole nother layer of things, as far as drugs and, what do you want to take? What don't you want to take? And everyone has their own opinion. But I had seen her, and she ran a battery of tests, just typical stuff you would run menopause panels. And she came back to me and she's like, hey, I just, I want you to know that your TSH, your thyroid, is elevated. So I'd like you to touch base with your primary care doctor. I'm like, whoa, okay, that's weird. But digress a little bit. My dad has hypothyroidism. My aunt has hypothyroidism. So I was like, oh my gosh, it's my time. So
like, this is just what's going to happen.
Yeah. And obviously I was upset because I'm like, I'm off all my pills. Like, I really don't want to be on levothyroxine. And so I called the primary care doctor and she's like, okay, well, let's do another test. And this was probably in October's when I got the first test. And in December, we did another test. And I had gone from like a 9.3 up to a 12.8. So
it's getting worse.
Yeah. So she's like,
and normal is from like 0.4 to 4 roughly on most tests. You were already,
we're talking about a TSH.
I said, almost, 13.
Twice as high to 3 times above, above the upper level normal. Okay, keep going.
And so I was like, no, this is not happening. And my best friend and I we really punch everything down together. Doesn't matter what we have. If one of us has a splinter or we just dig in with both hands and feet. And so we started just looking at some stuff, and I had been supplementing since I started plant-based. B12, your typical ones that you start when you're, not intaking any meat products and stuff. And so I was like, am I taking all the supplements I need? So we started digging, and she said, why don't you talk to Jeff? Run everything by Jeff. And so
you'd already been working with Dr. Pierce?
Yeah, I'd already been working with him. And we had met initially when I started plant-based and, just making sure that everything was okay. And as I was titrating off my drugs and all that kind of stuff. So I said to him, what do you think? What's your thought process? And he's like, well, let's talk about how strict you are. Well, I was so strict in the beginning. It was crazy. It's only been probably within the last year that I've kind of eased up a little bit. I eat out and we go to our plant-based group and eat. And he had said, okay, well, how much, what are you taking supplement wise? Let's relook at your supplements. And Nick and I had thought, am I getting any iodine? And I thought, no, because I eat nothing out of a box. I eat nothing. And she didn't think about it because they eat nori like it's going out of style. And I can't stand nori. So
the seaweed squares the
seaweed squares of any type. Seaweed is just not my thing. And yes, I was on my B12, and yes, I had my omegas and all of that kind of stuff, but I literally was not taking in any iodine. And we thought, could that be? And so when I met with Jeff, I said, well, what do you think? What do you think? And he's like, okay, you're not at critical levels. Let's try it. Let's supplement and see what happens. And I didn't have super high hopes sitting at like a 13 for my thyroid. I thought, okay, well, it's not going to hurt anything. And we felt medically that it was safe for me to just kind of hang on a little bit. And so I went to my primary doctor and I told her, I said, look, I think I might have an iodine deficiency. And she said, that's impossible. No one in the United States is iodine deficient. And I said, okay, well, can we check? Can we check? Like, you know, what can we do? What can we do? I said, how about a urine test? She's like, okay, all right, I'll call it in for you. And so I went into the lab thinking I was going to pick up my jug because there's a spot test and a 24-hour test. And I thought the 24-hour test is kind of the gold standard. So I thought that's what I'd be getting. But she ordered a spot test. So I did it. And
That's just being like a single pee sample, and then they check what the iodine is at that moment.
Correct. Okay. And so that's just like a bleep in your history. And at that point, I had not started my supplementation yet. So there was no iodine going through me at all. And so went in, did that, got the test results back, and she's like, it's normal. Mm-hmm. And so me and Nick dug in, and I had not talked to Jeff yet, but we dug in and found that on a lot of sites, Mayo, everywhere, WHO, that really my spot test was even on the very low end of normal, but they were calling it normal. So, and Jeff had said, let's go ahead and do it. So started the supplementing. And then at that point, I think, Jeff, is when I had asked you. So this has been, so in December is when I was at 13, the beginning of December. And then the beginning of January, I texted Jeff and I said, hey, can we do a test? Will you call in a test for me, a TSH? And he goes, yeah, totally. And so he called it in and I went in. So literally December 2nd to January 8th, my number went from 12.85 down to 4.6.
Okay, you're talking about the TSH.
The TSH with 125 micrograms of iodine a day. And I use liquid iodine. So it's literally like, I had to be careful at first when I was taking it because I had to do it in the mirror. It's like literally one drop. So it had dropped down. And so I had to follow up with my primary. And I went in and I did it all through so she could actually see the test that Jeff had called in. And she's like, what happened? What did you do? And I said, this is what I did. But in the meantime, and I'm sorry, you guys, I kind of skipped forward, which I wasn't supposed to do, but I did. But in the meantime, they had looked at Hashimoto's. That was the first line. They had done all the testing.
So they're looking for antibodies, and those
antibodies.
were negative?
Yeah. I happened to be at the neurologist at the time for something different. And I don't think I had any blood left by the time he got done because he did all kinds of testing. Because the main thing was they were sending me to endocrinology. Mm-hmm. So when I went into my primary and she looked at the test that Jeff had done, she's like, something's not right. What did you do? And I said, well, I didn't have Hashimoto's. All the rest of the tests were coming back fine that they were looking at. And she said, I still want you to go to endocrinology because I can't believe that these numbers are correct. So went to endocrinology, and endocrinologist, I'll never forget, endocrinologist walked in and she goes like, wow, you have cured your hypothyroidism with iodine. And I said, well, I think my hypothyroidism was a side effect of my iodine deficiency. And she's like, people aren't deficient in the United States. And I said, but I was, I am, deficient. And so she ran another test, another TSH. And that was all the way down to 2.6, I think, is what it was down to at that point in time.
Yeah.
So,
well in the normal range.
Well in the normal range. And, the hardest part was, obviously having the people that you're counting on in your team to help you navigate this. And all they wanted to keep doing was, you need to take the drug, you need to take the drug, you need to take the drug. And if I needed to take the drug, I would have.
Meaning levothyroxine.
Yeah. I would have taken it. I'm not opposed to, thank goodness we have medications to take when we need them. So I wasn't opposed to it at all. It's just, I felt like my concerns were not being addressed by anybody but Jeff. So, and even Jeff, Jeff, you can comment, but even he was like, okay, well, look, you're at 13 and it's not dangerous. We're not at dangerous levels. So I'm right here if you need me. And let's do this for a few weeks and see what happens. Actually, he had said, let's do it for, I think you had said 4 to 6 weeks.
Mm-hmm.
And meaning the iodine supplementing?
Yeah, the supplementation.
Before doing a medication. Okay.
And granted, people would probably want to know, was I symptomatic of hypothyroidism? And I guess I was a little bit, but I had some other things going on. So I couldn't really tease apart like the fatigue and the dizziness and stuff from the hypothyroidism versus the other stuff I was dealing with. But
did you ever have any cold intolerance or hair shedding?
No, I did not.
Dry skin? Okay.
Mm-hmm. I did not. I had some changes in my nails, but once again, I'm dealing with menopause too, right? So it's like, so what's that? What's this? And I think one of the hardest things for me was the symptoms. What was actually causing the symptoms that I was having. And they were not profound in any way, shape, or form. So
I think that's what helped give us some time, Deb, was if you had said, I can't get out of bed, I can't walk to my mailbox, I'm
right.
Because people can go into what they call myxedema coma, where you're so hypothyroid, your metabolism rate has gone down so far that it can be life-threatening. And but you're like, no, I don't have any of those things. And so even though the number was quite high, what gave me the reassurance was that that you were your symptoms were so few, and B, that you're such a good communicator, right, that I knew I would know the same day if something changed. And so that gave us time to try really what was, I think, you heard Nicole's suggestion, which is like, let's just do the iodine first. I want to wait for the
right
for the levothyroxine supplementation. And it was easy for me to say, sure, I support that. Let's just keep an eye on you closely. It looks like Liz was asking me if you got super constipated with those. I don't know.
I did not, because I eat so clean and my fiber intake is like enormous. I didn't have any constipation. Again, that's the hardest part for me, was really what was telling me something was going wrong was the numbers.
Yeah.
And not, yes, I was having some symptoms, but I couldn't tell whether they were menopause symptoms, whether they were just the dizziness symptoms that I had been having, which was why I was at the neurologist, or it was the hypothyroidism. So
Yeah,
That
which
was
can also affect your sleep, and a lot of
and
people have
yeah,
issues
and
with
that
sleep
was
in
not
menopause.
happening,
Yeah.
you know, it wasn't happening at all. Um, so the funny part about it was before we decided to do the supplementing, I had, done a dive. I was just looking for anything, everything, as some of us do. As some of us do. Thank goodness we do have the internet for that. But it wasn't until like I think I came across a September podcast that Dr. Barnard had done
Mm,
about older individuals and what they needed for
mm,
supplements. And I think his was like over 65.
mm,
And I'm 60 right now. Um, and I thought, oh, I should just listen to this anyway because I'm so tuned into supplementation now. And out of the gate, out of the gate in this podcast that he was doing on Physicians Committee, he had referenced the fact that in our current food industry, that we are not using iodinized salt as much as we used to because
yeah.
it's not cool, it's not sexy as, Himalayan salt and
Yep.
everything else. So that there are many people that are probably teetering on the edge of deficiency and don't actually realize it, which I thought was super, super, and it was very validating, actually.
Mhm.
It was super validating. Um,
Cool.
yeah.
I think that's good to him that he was talking about that, Neil Barnard, on that from Physicians Committee on that podcast, because really the only population right now that the U.S. recommends iodine supplementation for are pregnant and lactating women, and the average adult needs 150 micrograms per day. Pregnant women and lactating women are more in the range of 250 to 290 roughly, because it's important for mom and important for the developing fetus and for the newborn baby. But I think your point and his point as well, where is that there more and more people are at risk for being low in iodine because we are not. We eat plenty of salt. Most folks in the United States eat plenty of salt, but that salt is becoming less and less likely to be
Mhm.
iodized.
Iodized.
And because sea salt doesn't have has negligible iodine, and Himalayan pink salt, like you're saying, a lot of these fancy salts, which um, uh, we used to have in the 1920s when they first started to add iodine to salt. If you had asked your doctor back in 1918 about your low thyroid, probably one of his or her first suggestions would have been that you're not getting enough iodine, because they actually
Yeah.
had a what they called the goiter belt in parts of the
Yeah.
United States where there was
Mhm.
so much goiter, which is a swelling of
Right.
your thyroid over time, which from enough time of not having iodine in your diet, that was just commonplace in the United States. But thankfully, because of adding iodine to salt, that is no longer common. The problem is that salt, of course, they weren't adding it to the water; they're adding it to something that is potentially harmful when we get too much of it, particularly when it comes to heart disease and stroke. Right. So I was doing the math, I was looking it up, and it's about a half to 2/3 of a teaspoon of iodized table salt to get that 150 micrograms of iodine. And for folks who are really trying to limit their salt because of concerns, particularly over blood pressure, that can be a problem. So taking a supplement like you are still doing, is really the best way to do it.
Yes, and actually, subsequently, I was telling Dr. Davis that I just did labs 2 days ago,
Oh, okay.
and yeah, and my TSH, it crept up, but I mean, it's one of those things that can wax and wane a little bit, but it's like 3.7 now.
Yeah.
So
Great.
it's again, a confirmation of just Yeah, yeah. I mean, and it's hard when you're dealing with, um, again, a health issue that your healthcare team is like, "Nope, nope, nope. This is what needs to happen. This is what needs to happen." And maybe if I had been any other person than me, who's very stubborn and really digs into things, and having, a best friend that is also very stubborn and digs into things. So, um, I might have sat on the sidelines with levothyroxine pulsing through my system, and I
Yeah.
don't know what that would have done, honestly.
Well,
Like,
for you, it would have been a Band-Aid. It wasn't
yeah.
getting to the root cause of the actual issue,
But
right?
long term, like, what happens if
Right.
I had added iodine in? Like, now, I do eat out of boxes occasionally, crackers or whatever, and no, most of the time they've got sea salt or whatever, but I am reluctantly starting to eat some nori.
Yeah.
So, um,
I love nori.
I know, so does Nick, she loves it. So, um but, then what would that do? What
Yeah.
that coupled with taking a drug that is trying to even me out, just, I mean, a whole lot can go wrong. So I just am thankful that Jeff was patient and open enough to say, okay, this is what you want to try. Sure. Yeah. I mean, it kind of makes sense, and, um, then the doctors reluctantly, actually, subsequently, the primary care doctor's like, I just she actually apologized to me. She says, "I want to say sorry to you because, like, I never, ever have come across this." And she's a newer doc, so, um, she's like, "I can now put this in my tool belt," which is actually, as I said, before we came on, if it helps one person to, navigate something, my diet was pretty, what people have told me, radical, in the respect that there's no salt, no oil, no sugar, nothing out of a box, and that kind of good stuff. But there are people out there that do that. I mean, there are people that are out there that are very strict, that are, raw eaters, that are plant-based and SOS-free, and may not eat out because they're older, or they may not eat out because they just choose not to eat out. And, it's just something that advocating for yourself is so incredibly important. If there's one takeaway that I realized from this incident, is that you have to advocate with your healthcare team. Um, and even if you don't have anybody on your side, or you don't have anybody that's sitting side saddle with you, um, because, sometimes the drugs are important and you need to take them, and that's okay. But if you don't, you just keep digging, because there's so many things that we don't know, environmental things with conditions, and you just don't know. So
Yeah.
advocacy
Yep.
and a
Well,
good
Deb,
plant-based doctor by your side.
exactly. Well, and I would say, the two things that I'm noticing with this story is the first one that you've mentioned, advocating for yourself. Because doctors are still human beings who can make mistakes. Doctors have their own breadth of experience, um, that doesn't always match what other doctors' experience is, right? So it is really important to ask those questions, because ultimately it is your own health. You're going to care about your own health more than anyone else will. So the fact that you were willing to continue to dig and ask questions about this, that's really, really important. And then the other side of it is making sure that you have a provider who is experienced in this type of medicine. So I will say that, because I have worked with a lot of patients who do eat similar to that, where they're whole food, plant-based, SOS free, that is something in the back of my mind, because I have seen that before. I have seen people become iodine deficient, and that it can cause issues with your thyroid. And by the way, I just want to put this out there that the opposite can also cause a problem. So if you are supplementing iodine unnecessarily and you take too much, that can also cause low thyroid. So you don't want to just supplement for no reason. But certainly if you're SOS-free, you're being really, really careful about added salt, added sodium, being aware that that is a possible side effect, that you could have low iodine. But so that just goes to show that it is also important that you have somebody helping to watch these things, like Dr. Pierce was for you, who is more familiar with this, with whole food plant-based, and what are the kinds of things that we see with that. So the fact that he was willing to be patient with you and really help you to dig into this more before just writing a prescription, I think that, you know, both of those things, the advocacy and then having a lifestyle medicine doctor by your side, really helped you to get to the point where you were able to reverse this.
Right. And it and it is a good thing. And also, you know, I mean, people start into this. I mean, I didn't think twice about it when I started into this, you know, to being plant-based and SOS-free, because Nick had done all the research. So, and she had even said to me at one point, she's like, "I'm so sorry." She's like, I should have asked you, you know, like what supplements you were taking, or what, you know, I knew you were taking your B12, but I didn't know what else. So we talk a lot about supplements now, especially as we're getting into the next phase of our life and menopause and you know, bone health and all kinds of stuff like that, that we do talk a lot more about supplementation. And supplementations, I just personally think, is an important conversation that you have with somebody that knows what you're eating. You know, she eats the rainbow every single day. I do not. So when you're looking at how you eat and what you're intaking and how much are you intaking and where do you need to supplement? And Jeff and I talked about supplementation a lot, especially about calcium, but you know, it's super duper challenging to navigate and traverse supplementation, especially in where we live now, with there's a supplement for this and there's a supplement for that, and add creatine to this and add this to the, you know, I mean, it's just, so having somebody that knows not only what they're talking about, but like, where do you go for those supplements? Because that's the other thing. So,
Right.
you know, finding the right iodine supplement, and like, is it better if it's liquid? Is it better if it's, you know, in a pill? And honestly, an entire podcast on supplementation would be fabulous. because
Yeah,
you know,
good
you just
point.
don't know how to do it. You can't just walk up. Even now, 4 years later, I had a supplement shipped to me and they had changed it, and it had a bovine product in it.
Hmm.
But I wouldn't have even have known that had I not like flipped over. I noticed the bottle was different, and I flipped over the label and they had changed how they
Wow.
formulated it.
Yep.
Hmm.
So, you know, that's another hard thing when you're starting out, is knowing what to take and what not to take and how much to take and what
Yeah.
form. And
Yeah, and that's where, you know, I know probably Dr. Pierce as well, but tend to talk about supplements a lot because, you know, I have people coming to me who are on lots and lots of supplements. So we go through the list, you know, which ones do you need? Which ones do you not need? And then people who come to me on none at all, and we talk about, okay, are there supplements that we should be taking? So sitting down and talking with someone about that and having that individualized care, I think is really important. We do have a few questions that have come in, if you guys don't mind.
yeah.
So Rosie's asking, for a whole food plant-based person who doesn't have hypertension, high blood pressure, or renal, which are kidney issues, would adding regular iodized salt to meals be a good idea? If so, how much should be added in one day? Dr. Pierce, do you have any thoughts on that?
Yeah, I think so if you're thinking about iodized salt just for the iodine content, but right now you're not eating iodized salt, I'd probably just take so there are a couple ways you could go. You could take the supplement, which is very much regulated, that you'll be getting 150 micrograms per day based off of that drop or pill or whatever form it comes in. And then you don't have to worry about over time, adding more and more salt to your food and developing high blood pressure issues as things go along. Salt tends to make people, it makes food taste quite appealing. It's a element that speaks to humans, and so for folks who are working on their getting down to their goal weight, sometimes having less salt in their food is good for that, because having more salt makes it more appealing, then you're maybe more likely to overeat. And so I don't think there's a reason why you need to add iodized salt if you're going to take, if you could do that or take a supplement. But if you're like, hey, I hate taking supplements, I'd rather just get it from a little bit of salt. If your kidneys are fine and your blood pressure is fine, your weight's fine, then you could add a half a teaspoon of salt a day, assuming that you're not getting it in other sources, like canned and packaged goods and stuff like that.
Yeah, and I think that's probably the key there, is that I've really only seen issues with iodine deficiency in people who are really, really strict with SOS-free. So on a regular whole food plant-based diet that's oil-free, and even if it limits salt and sugar, if you're eating out, you're getting packaged foods, canned foods, you're probably getting enough iodine that way. So I don't want people to think that just because you eat a whole food plant-based diet that it would become easy to become iodine deficient. So that's where you can talk with your doctor about whether or not it's worth getting tested, if you do have thyroid issues, if that's a concern. But I would say for most people, as long as you're getting some kind of packaged foods, foods that aren't completely devoid of salt, then you're probably getting enough iodine. But that's a very general statement. So
Right.
not always the case. And then if you are somebody who likes to use salt, we always tell people, don't cook with salt, don't add it to things as you're cooking, as you're baking, because it's going to dissipate and the flavor is not going to really be there. So you end up adding more and more and more. Better is to cook without it completely, and then just add a small amount over the top of your food so that it's right there at the top and you can actually taste it. And if you're going to do that, use iodized, right? So get rid of the sea salts, get rid of the Himalayan salts, and use with the iodine. And then someone else had another good question. And we did, talk about this a little bit, but what are other good sources of getting iodine in your diet? And so that's where those sea vegetables, and I get plenty of sea vegetables. I make a noodle soup all the time where I cut little pieces of nori and put those in there. So I know that I'm getting plenty and I don't worry about it. But as long as you're getting some kind of veggie sushi occasionally, or using nori at home, that's a really good source.
Yeah, that sounds great. Don't invite Deb over for the noodle soup.
Don't invite me over for those.
She won't like it.
She won't like it.
I wish they liked it. Really, I want to like it. I want to like it.
I'm kind of in the same boat with you in that I don't like I've never liked fishy tasting things, even when I was an omnivore. And so the fishy smell of some of these stronger seaweeds is kind of off-putting to me, though personally, I'm fine with nori and veggie sushi. But I was looking at the sea vegetables, at the seaweeds recently, and folks, just be careful with a couple. Kelp and kombu, which is I guess a type of kelp, are very high in iodine. So a little goes a long way. So you have to be real careful with that. It's easy to overdo the kelp. Nori is lower in it, so you don't really have to worry about getting too much iodine from nori. Another one called wakame, Wakame, is kind of middle of the road and seems to be fine. But and probably the one absolutely to stay away from is called hijiki, Hijiki, which is just high in arsenic, which can increase your risk for liver cancer and stuff. So not all seaweeds or sea vegetables are created equal, and most people use nori as a go-to, or a little bit of kelp, once a week or once every other week or something like that. Just careful with it.
Great. And I'm so glad you brought that up, because I actually did have a patient experience where someone did have an elevated TSH, and we didn't talk about this too much, but an elevated TSH usually indicates low thyroid hormone. So they kind of work opposite to each other. But his TSH was elevated. And before we could discuss it and meet, he started taking kelp daily. And by the time we were checking his iodine levels, they were through the roof. And so had he continued to do that, that absolutely could have caused more issues with the thyroid. So making sure that you're working with your lifestyle medicine doctor, making sure that whatever you are taking in is appropriate, that you're not taking too little or too much, and that you're, getting that individualized treatment for whatever's going on with you. So, okay, great. Let's see if we've got any other questions. Let's see. Oh, so Rosie is an RN, so a registered nurse, and when she talks about a whole food plant-based lifestyle to help prevent and reverse, I assume, heart disease or maybe just chronic disease in general, people ask about the risk of iodine deficiency, concerned about hypothyroidism. So like I said, it is still very rare to become iodine deficient, but there's a special population of people where it can happen, like we talked about. Yep.
Don't be special.
Okay. Okay. And then, yeah, I think that, we've got a few other questions here, but we've covered most of what people have been asking about here. Rachel was asking if you have the name of the supplement that you specifically took. I don't know if you know that or not.
I was scurrying because I knew that I just wanted an organic one. So right now I'm actually, I am still on the same bottle, because like I said, it's one drop. It's one drop. So yeah. I'm using Mary's right now. And it's one drop is 125 micrograms. There's a lot of different ones out there now. And I just chose that one because it was readily available to me at my local place to get supplements. And so that's just what I went with.
Nice.
And it doesn't taste bad. Someone asked me if it tastes bad. Now I actually had somebody say, "Oh gosh, does it taste?" And that particular one that I'm taking, I don't know about all iodines, but that particular, it tastes like nothing. And it literally doesn't have any sugar. That was my other thing. It didn't have a bunch of stuff in it. So, but surprisingly, it's very bland.
Pretty neutral. That's good. Neutral. I remember adding iodine tablets to my drinking water when we were camping as kids or something, and it tasted pretty nasty. I think.
Yeah.
Pretty high, pretty strong. And just in general, when it comes to supplements, is to try to get the ones that have third-party testing, right? Yeah. What are some of those labels? Is it NSF, or I can't remember now some of that.
The Environmental Working Group is one where you can search.
Oh, okay. Yeah. And usually on the bottle, they should say whether they have the third-party testing.
Yeah. NSF, because I think, is one of those.
Yeah. Okay, great. So that's one of the ways where you can just make sure, because the regulation for supplements is so spotty, and they can sort of say whatever they want on their labels. And so trying to get something that's been tested for purity is really important.
Yeah, definitely. Okay. All right. Well, I think that pretty much covers most of the questions that we got here today. Debra, thank you so much for sharing your story. I know.
Thanks for having me. Thank you so much.
Yeah, absolutely. I'm always impressed by people willing to share their health stories, because I know it is private and it's not always something you want to just shout out there to all of the internet. But like you said, I really do think that this is a really important topic, and it's helpful, especially for the people who are eating this way, that they need to know that this is something to just be aware of. Right.
Exactly. And
then again, that big piece of advocating for yourself.
My takeaway is the advocacy part. And honestly, you you know, your doctor gets 10 minutes with you, literally, classically, not Jeff,
Yeah.
but you get 10 minutes with your physician. And in that time, you know, it's not a lot of time. So really, definitely, you know, use your advocacy tools to get what you need, no matter what
Yeah.
you're dealing with.
Yeah. And, you know, and by the way, that's a good segue into, you know, working with us at Lifestyle Telemedicine, because we do have 30-minute and 60-minute appointments. So you
Yes.
get more time with your doctor. And we are very well versed in all things lifestyle medicine related and plant-based, you know, eating related. So really, we love to help people safely deprescribe medications as we can, and looking for things like this that might be a little bit out of the box for conventional medicine because they don't see these things often. But because we get to see some things that can happen more in this lifestyle medicine world, we know to watch for it a little bit more. So so feel free to come visit us at lifestyletelemedicine.com. You can always call us as well and talk to Susan, our patient care coordinator, who's incredible. We have doctors who cover all 50 states, DC, and international. So wherever you're from, wherever you're living, you'll have a lifestyle medicine doctor who can help you out. So please visit us at lifestyletelemedicine.com. We would love to help you out. And thanks everyone for watching today. Thank you, Dr. Pierce. Thank you, Debra.
You're welcome. Thank you.
All right.
Bye.
Thanks, everybody. We'll see you next time.